Hello everyone. Today's video is about how one can determine whether they have an issue with mold, even if mold illness, mold toxicity, even if they had a mycotoxin result that came back negative or of negligible significance. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So there's kind of a couple of questions rolled in here. I had posted a video a little while ago entitled "A Successful Protocol for the Treatment of Mold Illness and Mycotoxins." And so the comment on that post was, will you please share more about the mitochondrial support you offered for the patient that you had referred to in this video? I'm pretty sure I've been exposed to mold, especially being in Washington, and have the HLA mold gene, but when I did a urine mycotoxin test, it didn't test high to show mold. I'd love to learn once and for all if I have a mold problem. My joint pain and stiffness don't quite look like rheumatoid arthritis, even though rheumatoid factor is elevated to 36, and not quite like Lyme, even though I was positive. How could I know for sure? My ERMI, environmental relative moldiness index for home, was elevated but not real high. Hard to know, but my stiffness and joint stuff is stubborn and doesn't add up. So thank you for the questions. So yeah, the first question there, just a bit more about the mitochondrial support protocol. So I posted a video within the last week or so all about comprehensive mitochondrial support. So I won't redo that video right now, but please consider searching that out on my YouTube channel. It's the easiest place to find my videos because you can actually search for them. And it gets into the weeds of that, but basically the comprehensive mitochondrial support is a combination of a high potency multi-nutrient. The product I like the best is called Multi-SAP by the company Nutritional Fundamentals for Health, also known as NFH up here in Canada. You can look on their website, see what the ingredient list is. There are other multis out there that are comparably good. I just really like that one because it's really good and very, very well priced. And then there's another formula called Mitochondrial Support Formula, which is a high, very robust dosages of about 15 different ingredients, including amino acids like carnitine, proline, and taurine, antioxidants like CoQ10 and resveratrol and alpha-lipoic acid, vitamins like vitamin B1 in the form of benphthiamine, riboflavin, niacinamide, and vitamin B5, pantothenic acid. Some minerals, including zinc and manganese, and then vitamin E in all of its forms, so the tocopherols and tocotrienols, and then also vitamin C. I think that covered all of them. I think that's everything that's in there. So that is what the comprehensive mitochondrial support formula protocol looks like. So with respect to knowing if there's a mold issue or not, so in general, especially depending on where a person lives, but any place that's kind of on the more damp end of the spectrum, I feel like from my perspective, it's not a question of if someone's been exposed to mold. It's just more like, have they been exposed to pathogenic mold, and have they been exposed to a high enough amount of it for a prolonged enough period of time, and are they really genetically susceptible to that mold? So I feel like mold is potentially on the docket for just about any patient who's dealing with complex chronic illness. But yeah, that question of is this actually clinically relevant in my case is a question mark. And did the exposure lead to colonization? Is there ongoing exposure? So that can get kind of tricky. Now, when, let's see, there's, elevated ERMI, but it's not really high, it really depends on what species might be involved. So knowing whether or not there's mycotoxin producing species or not, and then if there are species that test positive in the home, do they line up with the mycotoxins that came up on a urine test? Now, when a urine test is done, like a urine mycotoxin test is done, and the levels are, say, just very, very modestly elevated, or they're present but not high enough to be considered relevant, then that's where certain questions come up. One is that it might not be mold. Another question is what kind of prep was done for the test. So was there a couple of days of abstinence from consuming foods that are known to be higher in mold? Was there a sweating provocation that was done leading up to the test to try to help mobilize more mycotoxins that might be kind of stuck in the tissues? Were things like antioxidants like glutathione or methylene blue or N-acetylcysteine or other things that can really help to upregulate the metabolism of mycotoxins taken within the few days leading up to the test, in which case certain tests can be impacted by that, and other testing methods aren't. So it could potentially render a false low or a false negative depending on the test that's being used. So there's a few different factors there. Also, certain labs pick up mycotoxins on some folks, and other labs don't. One of my mentors in this area, Dr. Jill Krista, a really brilliant, prolific speaker and writer about all things related to mold. She was recently on my podcast talking about pandas and pans, which are unrelated, but she was actually one of my first guests on my Overcoming Chronic Illness podcast a couple of years ago, talking about mold and mold illness. So I've seen her present some split sample results where she, has a patient, gets a urine sample or they produce a urine sample, and then the sample is sent off to 2 different labs and see what the results come back showing. And sometimes one lab picks up a whole lot and the other lab didn't pick up much, or vice versa. With the same lab sometimes says yes and sometimes says no, and vice versa for other labs. And so there can be inconsistency with different mycotoxin testing methods that are out there. So it can get kind of tricky. And then where it gets even trickier is that sometimes patients will test categorically positive for mold, but then we treat them for mold and they don't get better. They don't really see any improvement with how they're feeling. So the testing helps to guide us, and I think the testing is useful, which is why I do recommend it for my patients, but I don't hang my hat on the testing. What I hang my hat on is how patients feel with treatment. So if I have a patient and they have symptoms that aren't better explained by other conditions, they have a history of mold exposure, if their test results say yes, they're positive, or say like no, they're not positive for mold, but there's other factors that suggest maybe that they are, then I'm not opposed to doing a therapeutic trial where I put them on an anti-mold protocol for a month and see how they feel. And if they feel better, then we're probably working up the right tree. If they herc/have a detox reaction from it, then we're probably barking up the right tree. We're just barking too loudly up that tree. So I'm a really big fan of therapeutic trials. That being said, if I have a patient and I suspect mold issues, we do a mycotoxin test, it comes back negative, I will probably pursue other things before the mold. But if the patient is plateaued, treading water, whatever, not getting all the way better, then I would certainly, in many cases, and I have in many cases, and into the future, will continue to revisit the mold question, regardless of what a test result says, with a therapeutic trial, if it seems to make sense, and of course, if the patient wants to. With all that being said, there can be other things besides, it was mentioned here, about Lyme, and the same person had another post about mycoplasma, which can be implicated in rheumatoid arthritis, even if RF levels aren't super elevated. So I guess the long and short of it is, there are other things on the differential diagnosis list besides Lyme, mycoplasma, mold, and other co-infections for that matter, when it comes to an RA presentation or RA-like presentation. So there could be other things going on too. But just because there's a negative or minimally consequential mycotoxin results, then it doesn't, in my mind, anyways, doesn't definitively rule out that there's a mold issue. I hope that was of interest, of use. If anybody has any follow-up questions on this topic or anything else, just post it in the comment section below, and I will do my best to answer as soon as I can.